Tip number 5, prepare for challenging cases. So it's really important to identify areas that you personally find challenging and actively preparing for them. You know, for example, if you find it quite difficult to take a sexual history because you get a bit embarrassed when asking some sensitive questions, but that are really important, for example, risk factors for, sexually transmitted infections, you should actively practice this until you can do it confidently. You could, for example, do that in your study group or with your trainer. Similarly, some candidates, they might not have had much exposure to certain curriculum areas in everyday practice. They might not have done a job in their hospital rotations, for example, in ENT, and not seen that many cases for a particular condition in practice. So you can actively work through the CSA case checklist in, for example, the Pass the MRCGP study guide. And the link to that is at the bottom of this video. And think if there's anything here that I'm not confident taking a history, explaining, doing the examination, discussing the management, you could actively read up on it and then practice. Practice telephone consultations, because it can be quite challenging taking a history when you don't have some of the non-verbal cues that we rely on in clinic. Practice explaining common tests and conditions in clear, concise language before the exam. So on the day of the exam, you can do it really quickly, really confidently, and without using any jargon or technical terms, and this is unavoidable. This will also give you confidence that if you've actively practiced the things that you most fear, if you do get that as one of your early cases, it's not going to throw you into a panic and put you off. Tip number 6, learn to manage your time effectively. Some candidates that fail the CSA, the reason they fail is that they get a really low mark in lots of cases in the management domain. And often that's not because they didn't know the management, but they didn't have time to discuss treatment options or talk about things like follow-up or safety netting. And that's often because of the impact of not having concise history-taking skills. So, try to get comfortable with getting through the bulk of your consultation in maybe 10, 12 minutes the month before the exam. You might still be on 15-minute slots, but try to use the last few minutes to actually type up your notes. Whereas if you're actually needing 15, 16 minutes with the patient and then another 2 or 3 minutes to type up your notes, it's going to be really difficult for you to suddenly shave several minutes off your consulting time in the exam when you're also perhaps dealing with nerves.